we are continuously coordinating with the manufacturers and suppliers of the vaccines. So yung AstraZeneca keeps us updated on what's happening, including dun sa mga nangyayari sa Europe. We just had a meeting last night, and the findings really are that the blood clotting events are similar as to what would happen in a normal population without the vaccine, or in populations that are vaccinated even with other brands. No? And at the same time, yung Sinovac naman, we also already informed them that we have one report of a death of a patient who received the vaccine and then later on developed COVID-19. And we are asking them for information if there are any similar events that have happened in other countries. So our surveillance system is working, and we will continuously update, of course, the vaccine cluster as the vaccination rollout goes along, especially when we have our more population-based vaccination after the health workers. Thank you.
Thank you, Director General Eric Domingo. I think some of the questions of our media partners were adequately answered by your presentation. And as the presser that we have today is about the COVID journey of one of our healthcare workers who succumbed to the COVID-19 infection post-vaccination, we have here with us our Vice Chair for the National Adverse Events Following Immunization Council, Dr. Romel Lobo. Dr. Romel Lobo, the floor is yours po. Thank you.
Good morning, everyone. Can you hear me? Am I clear?
Yes, sir.
Thank you. First, let me explain what adverse event following immunizations are, or AEFI. It's any untoward medical event which follows immunization, which does not necessarily have a causal relationship with the administration of a vaccine. So, for example, you get vaccinated and then you get bitten by a dog. You should also report that as an AEFI. So kahit po related or unrelated, there should be reporting and it should be documented. So let me reiterate that the Department of Health, the National, the NAFIC Committee, and the Regional Adverse Event Following Immunization Committee are all committed to the health and safety of all Filipinos. Now, these two committees exist only to review adverse events and ensure the causality assessments are conducted properly and reported promptly. Now, any AEFI, the Department of Health, that these two committees will conduct a thorough investigations to identify the cause. And most of the AEFI, as been shown, are not serious. However, every single report of AEFI in the Philippines is treated with utmost seriousness. Causality assessment is a process to determine the cause of serious adverse event, and the process involves conducting field investigations, reviewing clinical records, compiling information about the circumstances associated with adverse events. It is a thorough examination of every step of the vaccination process, and it is done with great care. It takes some time to conduct and review the information necessary to provide an accurate picture of the circumstances surrounding the adverse event. Now, the process may be stringently followed as part of the investigation of this individual's death, now the one we're talking about right now. The cause was determined to be unrelated to the vaccination. The cause of death was COVID-19, and to date, there are more than 12,000 Filipinos that have died of COVID-19. The individual was a 47-year-old woman with known hypertension, diabetes, and bronchial asthma, which was declared in the health assessment form. She underwent RT-PCR testing in February 22, 2021. Her result was said to be positive and underwent another RT-PCR on February 23. Her results this time came back negative. And on March 4, on the day that she was vaccinated, With Sinovac, she had no symptoms upon screening, which she declared in the health declaration form. And on March 8, she tested positive for COVID-19. She was advised admission, but she refused. On March 10, she was admitted to the hospital where she was provided the appropriate care to manage her COVID-19 infection. Unfortunately, she died on March 13th of COVID-19 infection, and the COVID-19 vaccine does not cause, as we all know, COVID-19 disease because it's an inactivated vaccine. And none of the vaccine used in the Philippines can make people sick with COVID-19. So I turn it back to you, Laura.
Thank you so much, Dr. Lobo. Again, some of the questions of our media partners have been adequately answered by your statement. We also have here with us Director Beverly Lorenho on behalf of our official spokesperson, Undersecretary Maria Rosario Singvergere. I will skip through some of the questions that you asked because these were answered by Dr. Eric and Dr. Lobo. So I'll go straight to Director Beverly Ho and ask her, with all these facts presented, Director Bev, will vaccination be suspended?
Well, Laura, it's very clear from the report, there's no reason to suspend our vaccination program, as first, the vaccine is not what caused the death of our healthcare worker, and second, as DOH and FDA has continued to emphasize, the benefits of vaccination continue to outweigh the risk of us getting COVID, particularly severe COVID-19.
Thank you, Director Bev. I guess the question for Dr. Lobo or Director Bev or DJ Eric is, how did the healthcare worker get COVID-19? Does that mean that she was incubating when she got vaccinated? The question also has been answered, no? Did the healthcare worker have symptoms on the date of vaccination? Dr. Lobo and then DG Eric.
We all know from our day-to-day census that there's an upsurge of COVID-19. We can identify them if they're symptomatic, but we do not know who are asymptomatic. So surrounding us, we may be infected by someone who is asymptomatic, not having any symptoms. So the patient might have been exposed to a individual that she had encountered, and then she might be incubating or having asymptomatic symptoms at the time that she was vaccinated. As seen in her health declaration form, she declared her comorbidities as hypertension, diabetes, and controlled bronchial asthma. Okay, she was on maintenance bronchial asthma. It was a long-acting beta-2 together with an inhaled steroids. So the symptoms are all controlled. And we know for a fact that there's a certain period of incubation through the days that followed. She developed the symptoms after vaccination. So as I've said, the vaccine does not have anything to do with the infection. The exposure would have, is responsible for this. The COVID-19 virus could be responsible for all the symptoms and could have explained all the manifestations that the patient had.
Thank you, Dr. Lobo. DG Eric.
Yeah, if you look at all of the clinical trials during the development of the vaccines, you will see that people who have been vaccinated with the vaccine, as compared to people who were given a placebo, there's no difference in the incidence of COVID-19 for the first few weeks. No? In fact, nagsastart bilangin yung difference between the two groups after the second dose is usually given. This is because during the first few weeks after you're injected with the vaccine, you have no protection. This is the time that your immune system is trying to develop. So talagang expected, no, na first few weeks after vaccination, your risk of developing COVID-19, getting the illness and getting severe illness or probably and possibly dying from it is the same as a non-vaccinated person. So ito po yung lagi nating pinapaalala, lalo na po sa mga health workers and high-risk individuals. If you do get a vaccine, do not suddenly change the way you are doing things. You still wear the mask in exactly the same way. You still distance yourselves from everybody. You still wash your hands frequently, and you still don't eat in groups, no, because there's no protection during the first few weeks. And we always have to we just keep that in mind. Na talaga pong pag nabakunahan tayo, yung first few weeks wala pa pong protection na bibigay sa atin against COVID-19 yung ating
Thank you, DG Eric. Those were very, very clear points. On that note, I'd like to direct the question to Director Beverly Ho. Given what happened, is the government considering requiring any form of test to make sure the recipients of the vaccines are not COVID positive? Director Bev?
So it's very clear in our protocols, which have been reviewed by our experts, independent experts, particularly also our NITAG and TAG, that as part of our protocol, everyone who goes through the vaccination process will have to answer the health declaration form and is also screened by the health worker in the facility. So the questions would actually include their possible exposure and their symptoms. So those who report exposure or show symptoms of COVID-19 are actually not recommended to be vaccinated, and they're actually requested to send home. So at this point in time, there's no changes in our protocol. And also, if you will look at any other country in the world, we don't do testing prior to vaccination as part of the screening.
Thank you, Director Bev. Again, for Dr. Lobo and DG Eric, why is it that we are not recommending COVID-19 vaccination for those who just recently recovered from COVID-19 infection? Dr. Lobo?
It is not recommended for those individuals who just recovered, primarily because we know if you just recovered, you develop an antibody protection. And this antibody will, plateau and then maybe level off and die down or go down in 3 months or so. Now, with the limited supply of vaccines, we need to prioritize individuals who have never had or never been exposed to COVID-19 virus, so they don't have any protection. With the limited supply, we can prioritize them. Vaccinate them first, and then those who have recovered maybe after 3 months or 4 months, they may now be a good candidate to be vaccinated, primarily because their antibodies have already waned down from the natural infection. So doon lang sila, kanya may 90-day period na. Remember, the 90-day period should be counted when they recovered, hindi yung when they were diagnosed. When they recovered, wala na silang symptoms. Just to be clear.
Okay, thank you so much, Dr. Lobo. So that's very clear that it's not really a safety concern, but more of an efficiency concern, that those who develop COVID-19, meron pa silang protection. So the limited doses should be given to those who have not been infected by COVID, but continues to be exposed. No? So for Dr. Lobo again, how did the committee determine that the cause of death was COVID? Many people are asking, even Dr. Raquel Fortun is asking if there was or there will be an autopsy of the body. Dr. Romel?
The investigation was a systematic review based on WHO recommendations, clinical guidelines followed. There's a template that we do in investigation form. We need to formulate an answer first. We need to formulate a question first before we start the investigation, whether the cause of death of this individual was secondary to COVID-19 or to the vaccination. But definitely, from the systematic review of all papers and all the documents and clinical presentation of the patient, it all pointed down to, one, that the patient died of COVID-19 infections following the clinical course of your COVID. Second, we all know that the vaccine is inactivated. As Dr. Domingo had said, that it does not cause any even an immunologist like myself will tell you it cannot cause infection because it's a dead virus already. It will just stimulate your immune system to develop an antibody response. No. Third, we all know that once you be vaccinated, you do not develop antibodies outright. It will take you several weeks before you develop an immune response. So maybe two weeks or 3 weeks, you develop an antibody response. That's why we need to give a second dose to boost this immune response. So from the clinical picture, from the papers that we reviewed and the investigations and the evaluations, it clearly pointed out to a death secondary to the coronavirus infection and not to the vaccine that the patient had received.
Thank you so much, Dr. Lobo. Another question here is, did the healthcare worker have, although this has also been answered, but I'll ask it anyway, no? So did the healthcare worker have any comorbidities? If so, did these have any effect on their death? Was the vaccine manufacturer informed of the development, and what was their reaction and their next steps, if any? Dr. Lobo?
The patient had comorbidities. According to the health declaration, she had diabetes, she had hypertension, and she had bronchial asthma. The bronchial asthma was controlled with maintenance medication. The patient was vaccinated with, prior to her vaccination, she was screened for whether the blood pressure was elevated and it was normal. And then diabetes, she did not, according to the record, she was not on any maintenance medication for diabetes. Maybe they just did modification of the diet. That's why maybe there's a control of the blood sugar. So the comorbidities present in this patient put her at risk for developing COVID-19, but it will not contribute to the will not contribute to the association or contributed to the death of the patient.
Laura, just to add, no, I did, so yung question on the communication with the manufacturer, we did. No? So once the NAFIC assessment was completed, as a matter of a regular course, we informed the manufacturer through the local distributor that there has been such an event, and we are currently awaiting if they have any information of similar occurrences, of course, in other countries where the vaccine has been rolled out. I believe it has been rolled out used in millions of doses already in other countries, and we would like to know information from them. Pero so far, of course, wala pang sagot kasi late na rin naman, kahapon din naman natapos lang yung ating NAFIC assessment.
Thank you, DG. Doc Romel, not sure, last question na lang po, no? Not sure if you can answer this, but yung tanong is, she tested positive on Feb 22 and then negative on 23. Yung tanong po dito is, why was she given Sinovac or the vaccine po when she tested positive, wala pang 2 to 3 months?
The determination that the RT-PCR then was in February 20, that was February 22, she had positive results, right? And then by February 23, it was negative. According to the infectious disease consultant that had been consulted by the RAFIC, at that time, they mentioned that they tried to look at the threshold, the city threshold of determination, and they made a decision, they made a call on that point that the positive RT-PCR could have been remnants of the previous infection. Remember that the patient had had the previous COVID-19 infection in 2020. That was the previous year, di ba? And then just this year, they did a determination. Parang they said that it was a remnant of a previous infection. And it was deemed no longer really positive. She's not anymore infective at that time. So yun yung determination.
Okay, thank you, Dr. Lobo. With that, all other questions po, we will be answering in the Viber na lang po or in a separate presser. I asked DG Eric if he has some few words, reminders on how best we can feature the news today. Dr. Eric.
Well, for us, though, for the FDA, I think from the start, we've always been saying that since we are using vaccines under emergency use authorization, talagang the big part of it is we have to have very good monitoring and surveillance. Now, we're happy that the reports are coming in and that the surveillance is working, but we just have to remind everybody, kasi ngayon, konti pa lang naman tayo, no, health workers pa lang. Once we start the community-based vaccinations, it's going to be a lot more. And we'd like to ask all vaccine delivery personnel to please take it seriously. We need this information. We need to see if there's anything happening, and we have to refer it immediately to the proper NAFIC or NAFIC for assessment so that we can always quickly assess if there's anything that we have to calibrate. And of course, doon naman po sa mga nabakunahan, ang lagi lang nating paalala, kapag po kayo nabakunahan, hindi po yun magic na biglang hindi na po kayo pwedeng magkaroon ng COVID. It takes time. You have to give your body time to develop immunity and resistance against the COVID-19 virus after a vaccine is injected into your body. So kailangan po right after vaccination, ganun pa rin po ang pag-iingat dahil meron pa rin pong risk, especially the first few weeks after vaccination.
Thank you, Dr. Eric. Dr. Romel Lobo, your words po.
Let me express it like this. All COVID-19 vaccines being used in the Philippines have met rigorous scientific standards for safety, effectiveness, and quality of manufacturing. The Causality Assessment determined that the cause of death in this case was COVID-19. Therefore, any discussion of the vaccine itself is not relevant to the conversations about this individual case. And let me also declare that I myself, along with millions of others, have safely received the COVID-19 vaccinations such as CoronaVac. Now, having said that, I would also like to echo what Dr. Domingo had said. Na after being vaccinated, for example, you completed the 2 doses already, that is not already a safe path for you to not wear your mask, do not wear the face shield, not socially distance, and not to practice hand hygiene. Remember, the vaccines are not 100% protective. They have a certain, there's a certain percentage that it may not protect you. But at least it will give you a certain protection from severe COVID or moderate COVID, so that do not let your guard down. Practice social hygiene, social distancing, hand washing, wearing of the mask, and wearing your face shield properly. Please wear them properly. That is important. Pero kang face shield pero nandito, tapos yung mask nandito sa So that's still not protective for us. So back to you, Laura.
Thank you. And on behalf of the DOH Undersecretary Maria Rosario Singh Vergere, Director Beverly, your final message, please.
Hi. Thank you, Laura. We wish to thank everyone who participated in today's media forum and everyone who's watching us over Facebook Live. By now, sa danami po nung tips at advice na binigay po ni DG Eric tsaka ni Dr. Lobo, we should be able to be fully conscious about the value of having and sharing the correct information, especially in times like this. We thank our partners in the media for reporting the incident very responsibly. While we regret the occurrence of this event, we also wish to reiterate again and re-emphasize that all the vaccines that the FDA has approved and are currently being rolled out in the country they remain safe and effective instrument in helping prevent severe cases of COVID-19 infection. So the causality assessment, which you have just heard po kanina, has determined that there is no correlation between the vaccine and this event. And so our national deployment of the COVID-19 vaccine shall continue. We also want to reiterate that the benefits of the vaccines continue to outweigh the risk, no? And so for everyone's continuing safety, we must all continue to practice our intensified public health standards of correct usage of face mask and face shield, physical distancing, and at least 1 meter complemented with adequate ventilation, especially when you are indoors, and correct hand washing techniques. In particular, we all usually put our guards down when we have our meals together with families, friends, or co-workers. Now, we need to be very conscious about this. The ability of these practices to stop transmission has already been proven, and we only need to do them correctly all the time, consistently. If we adhere to these practices properly, then we could all guarantee the safety of each other, and we can also guarantee our country's ability to see this pandemic. So maraming salamat po ulit sa inyong lahat, and have a good day.
Thank you, Director Beverly
Laura?
Ho. For all EUA-related questions, I am pleased to announce that DG Domingo will also be our resource person for the media forum tomorrow. So we'll be asking your questions na rin later sa Viber group para we can prepare for them. With that, I thank DG Eric, Dr. Lobo of the National Events Following Immunization Committee, and Director Beverly Ho. I also thank our WHO consultant for crisis comms and risk communication, Suzanne Curba, and Dr. Gabriel Burlongan. Have a good day po.